Carl Estler, and I have headachestop.com, where we treat TMJ. TMJ is temporomandibular joint, or TMJ is really, the proper name would be temporomandibular joint dysfunction. We usually call it TMJ for short. TMJ is extremely easy to understand, but it's kind of hard to treat if you don't have it. If the doctor hadn't had it, it's a real mystery. But let me show you on this model, and you can really see all TMJ is. First of all, let's look at the lower jawbone. It is very unlike any other jaw joint in the body, any other joint, in that it actually comes out of socket on purpose without damage. The lower jaw has extreme movements. In fact, the lower jaw comes together really just by suggestion of the upper teeth. So if your upper teeth demand that the lower jaw to come together with as many teeth as possible, go way back in the joint space and push up against the ear canal, that, like this model does, that would be TMJ. If I felt in your ear when you bite together, which is one of the main tests for TMJ, and I felt your ear canal just collapsing, I would say, well, you certainly have the arrangement of jaw joint ball in the socket that usually causes TMJ. Now, if your manifestation of stress and pressure is gritting your teeth, well, then you're going to traumatize the back of the jaw space. Now, if you were biting together where nature intended, where the ball of the jaw joint was right on the continuation of the cheekbone, you could bite as hard as you want. The body can take it there. But if your arrangement of upper teeth is such that the lower jaw has to compensate by going back, and then your protective mechanism for stress, or you're getting ready to fall or be in an accident, is to clench your teeth to protect your teeth, at the same time you traumatize this area. Now, as this area becomes traumatized, it becomes swollen. So now when you grit your teeth, you hurt it even more. And the muscles, for some reason, instead of letting off, have a subconscious urge to grit more. So the muscles are overworked, and now they're going to spasm, and you can hardly even open. So typically a TMJ patient comes into me and I say, show me how far you can open, and they'll open about like that because they've so overworked these muscles. So what we do with TMJ, the surgery doesn't help, and really all we do is position the jaw forward by putting a piece of plastic in between the teeth that fills in this little gap and holds the jaw forward, particularly at night where you can't oversee and prevent the trauma to the back of the joint space. Let me show you this other model. Let me show you what normal is first. Normal would be the teeth all come together, and there's a little space between the ear canal and the ball of the jaw joint, and as I showed you in the other model, you can bite as hard as you want. The body can take it. But if the arrangement of your teeth is like mine, or like this model, where if the jaw is in the proper space, the teeth don't line up, the jaw will compensate by moving back. Now, instead of the cartilage disc cushioning between the ball and the bone, it cannot move back here, so you get the trauma to the back of the joint space. Now, in a lot of offices that the dentist hasn't had TMJ, he'll make you a flat plane splint like this, with the idea that you could scoot forward, but with the muscle memory, you still bite the old way. So what you have to do instead is use what's called a pull forward device. There's hills and valleys on both sides, so when you bite together in your sleep or during stress, it actually pulls the jaw forward and away from that area. The trouble with this, as I mentioned, understanding TMJ is the simplest thing in the world. Treating it's a little harder, because how am I going to adjust this? I've got hills and valleys, and it's not just a flat plane, so it's going to be hard to adjust. And as we pointed out, TMJ people already have sore jaws, so if I ask a TMJ patient to open wide and adjust, it's going to make their jaw really sore, more sore than when they came in. So the simple thing to do for a doctor that has TMJ like me is I just make the appliances outside your mouth. I just make them outside on an adjustable articulator. I have you try one, and if you say, no, that's not quite it, move it over to the left a little bit. I'll go back in the lab and use some heat-sensitive plastic, warm it up, liquefy it, cool it off, bring it out, and then you'll say, yeah, that's it. The thing with TMJ, another difficulty in treating it, is as I bring you forward, and as you're not traumatizing the back of the jaw space, the requirements of the bite change. It's like a moving target. But since I'm making these outside your mouth every time you come in for a week, I'll just make you another one. And so that's why TMJ is hard to treat. One appliance will get you out of pain temporarily, but then you'll go right back into pain. The doctor without much experience says this patient is just a drug seeker, and yet that's what you would expect with an adult with TMJ. You need multiple appliances And if you adjust them outside the mouth, it's so much easier. And it's easier because when you look through a microscope, you focus it left, right, finally get it in between. When you do TMJ work, the patient says move left, 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 left over a period of weeks, and finally they go past the sweet spot and realize they have, and if I'm adjusting in their mouth, I've just ruined an appliance we've worked a month on. So now we're starting over. Doctors, frustrated, patients frustrated. So the way I make it is I make these temporary appliances, and we just make a new one each time. If the patient, in fact, this happens every time, the patient says, doc, I think the one you made me 2 weeks ago was the one. That's the one I'm wearing, and that's what I expect. So we have a phase 1 where I use these temporary appliances that do 2 things. It finds where your bite is, the comfortable bite, and it shows us the improvement you're going to get from that. It costs about as much as maybe 2 or 3 fillings, what I charge. It costs us way more than that to do it. If you get a very good improvement, which is what we expect, and I feel it's a very good improvement, at that point we can go to phase 2, which takes about a year. We make 3 different appliances. We adjust each one. Usually at about the 3 or 4 or 5 month mark, you don't wear one during the day. We've just trained the muscles so that during the day you just rest your jaw forward end to end so that the ball and socket is in the sweet spot. And during the night when you can't control what you do, you wear the appliance. So you can see where TMJ is such can be a painful situation, yet it's not anything that requires any surgery, and it doesn't require any pain to treat. In fact, I tell my patients it's no shots, no pain, no surgery, just relief. And we have the phase 1 to see what kind of result. There's no obligation to go from phase 1 to phase 2. If you're having this kind of pain, and you can check it yourself, you put your fingers in your ear, you bite together, you can feel your ear canal just collapsing, and it's kind of sore in there, almost as though you have an earache, you have TMJ. Come to me, headachestop.com, and we can give you a free exam, and if you decide to go forward, we can start phase 1, and you can see exactly the improvement you'll get before we go to phase 2.